Oh, thank you. International Safe Abortion Day originated in Latin America and the Caribbean, where women's groups mobilized for more than 30 years to demand their governments decriminalize abortion and provide safe access to abortion care. The date, September 28th, was chosen in commemoration of the abolition of slavery in Brazil, which is now remembered as the Day of the Free Womb, demanding safe and legal abortion for all. International Safe Abortion Day reminds us that the Catholic Church is a global church. The hierarchy is actively working to limit abortion and make it less safe in countries all around the world, and pro-choice Catholics must speak up. The Catholic hierarchy applies major political pressure to limit the availability of reproductive health care services worldwide. The far-reaching impact of the Catholic Church is often overlooked. The hierarchy's influence shapes laws and courts globally. This includes restricting safe access to abortion, not just in the US, but internationally. So with that introduction, I want to briefly pivot to my colleague Shannon, the Director of Policy here at CFC, who will tell us a little bit about Catholics for Choice and our vision and our work in reproductive justice.
Thank you so much, Manuela. This is our second International Safe Abortion Day in a post-Roe versus Wade world. And we know that safe abortion access has been front of mind for those of us in the US, given this, overturning of major Supreme Court precedent. And we also know that even when Roe was in place, so many people could not access abortion care because of the ever-expanding barriers that were put in place. So Catholics for Choice is a US-based organization, but we're proud to work with pro-choice Catholics all around the world, not just here at home. So over our 50 years of existence, we've partnered with Catholics in Poland, Chile, Malta, Uganda, Ireland, and so many more countries. Sometimes our collective work is really hard, and we spend our time fighting back against abortion bans and restrictions that are supported by the Catholic hierarchy. But sometimes we win, and abortion access expands, consistent with public opinion. So for instance, in August of 2022, only a couple of months after Roe was officially overturned, reproductive justice activists in Kansas brought hope to our entire movement by driving astounding turnout in the primaries and soundly defeating a proposed amendment to the state constitution that would have removed the explicit right to an abortion. I think it's worth noting that the Catholic Church in Kansas spent upwards of $3 million in support of this proposal, which means that was over half of what was spent toward passing the referendum. In the midterm elections that same year, voters continued to demonstrate just how popular protecting abortion access is. Vermont and California passed constitutional amendments affirming abortion rights, and anti-abortion amendments were rejected in Kentucky and Montana. In Michigan, where we heard reports of Catholic bishops requiring an anti-abortion letter to be read before every Mass in the lead up to Election Day, voters still overwhelmingly affirmed the right to abortion access. As we look toward the future, Catholics for Choice knows that no matter what the hierarchy says or spends, abortion is a winning issue, and we're making investments in Ohio and Florida to ensure that similar expansions of access for people on the ground happen as soon as possible. So this International Safe Abortion Day, I'm really reflecting on all that we've done and all that we have to continue to do to ensure that abortion is safe and accessible for anyone who needs it. Catholics for Choice is really committed to working in partnership to counter the political overreach of the Catholic Church in the US and around the world, because we believe that everyone deserves to make medical decisions according to their own conscience. Those are the three principles of pro-choice Catholicism. That's Catholic social justice, freedom of and from religion, and conscience. We thank the providers who offer abortion care and help people safely receive this basic medical procedure. So with that, I'd like to start this conversation with our great panelists by throwing it back to Manuela.
Thank you, Shannon. Thank you so much for that. And we are going to dive right into today's discussion. I'd like to properly introduce Dr. Tlaleng Mofokeng and Dr. Josie Urbina. Dr. T is the United Nations Special Rapporteur on the Right to Health, a medical doctor with expertise advocating for universal health access, HIV care, youth-friendly services, and family planning. She has experience in advocating training for healthcare professionals, and her areas of focus have been on gender equality, policy, maternal and neonatal health, universal health access, post-violence care, menstrual health, and HIV management. We also have Dr. Josie Urbina here with us today, who's joining us from the West Coast. Dr. Josie is an OBGYN and complex family planning specialist working at San Francisco General Hospital, an assistant professor for the University of California, San Francisco at Zuckerberg San Francisco General Hospital at the Division of Obstetrics and Gynecology. She's also a researcher at Advancing New Standards in Reproductive Health. So, I'd like to ask you both this first question, if that's okay. And I'm going to ask Dr. T to go first, and then Dr. Josie, if that works for everyone. So our first question for you both is, since the fall of Roe versus Wade in the US, what has changed in your everyday jobs, both in how or what care can you offer to your patients, and how can you speak about this, the importance of your work? What can you tell us about this new reality that we're in, that you can see in your day-to-day life, and how has it affected what you do and how you do it? So I'll pivot to Dr. T first.
Okay. Thank you for inviting me to spend time with you on this session. I am an abortion provider, and I think it's important to also say that I work from Johannesburg in South Africa as a medical doctor, and that through the global gag, which is tied to the Presidential Emergency Fund for HIV PEPFAR, we've been dealing with what looked very much like the restrictions that happened because of the Supreme Court with Roe v. Wade being overturned. And so that foreign policy and those foreign investments in places like South Africa have already been limiting me as a healthcare worker in working with other colleagues who are working in HIV, for example, in maternal care, for example, in education, reaching young students with mobile clinics in schools. And I was limited in giving information, providing the service, advocating, or being involved in any advocacy around policy or legal reforms around abortion, even though in South Africa, abortion is legal. So that's just one impact of my work directly as an abortion provider. And so what Roe v. Wade did was heighten that anxiety and further fracture my ability to work with my colleagues and move and build a movement around women's rights and women's access to comprehensive care. And we know that with every Republican president, there is that threat that the global gag will be expanded, and that reality became true under Trump's presidency. And so these continuing threats to funding, to support, to grassroots movements really does actually fracture and weaken our ability as civil society to do our work collectively, because then we have to choose between one important issue around HIV versus another equally important issue around contraception and abortion access. on a global space, I actually supported that court case in the Supreme Court with an amicus brief, which is a third-party intervention in my capacity as the UN Special Rapporteur on the Right to Health, urging the courts to abide by international human rights laws and standard, urging the courts to realize that the right to health is intrinsically linked to women's other rights to economy, education, civil, political participation, and that by restricting abortion at that level is a violation of human rights. Thank you.
Thank you so much, Dr. T. That's a great response and also a very appalling, but very real. So thanks. Dr. Josie, please.
Hi. So I just wanted to say thanks so much for having me on today. And with these abortion restrictions, it's always the most marginalized communities that are affected the most. And for here in the US, it's communities that include but are not limited to Black, Brown, Native American immigrants, the LGBTQ community, non-binary folks, and the poorest of our communities. These are the same communities that have, in our history, have experienced reproductive coercion, and here in my state of California, forced sterilizations, and most recently, like what we've seen in the carceral system. Surprisingly, we've also seen forced hysterectomies in ICE detention. And so it's just a long pattern of reproductive coercion that marginalized communities have to deal with and overcome. And it just means more barriers that, those already having a hard time need to overcome in order to get sexual and reproductive health care. For me in particular, it's really hurtful to see people that I identify with that look like me, that speak my native language, Spanish. They have been so affected by these laws, particularly immigrants that are crossing the border. We've had a constant influx, as where I am in California, of patients that have been raped on the border. Some of them being, in their 20s, in their teens, and even adolescents that are now arriving in their third trimester, arriving to us in their third trimester because they've been trying to get care, in the surrounding states and have been unlucky in getting so. And this is something that, we don't really talk about too much in the media. And I'm glad that I have a platform now to highlight this very specific need of what people don't see of our immigrants not only having to traverse a very dangerous border, but also being subjected to rape and sexual assault. For me in particular, all the way in California, we've had an influx of people seeking abortion from out of states, from states as far as Florida, Louisiana, Tennessee. And although there are closer hospitals and abortion clinics that people go to for their care, the wait list to get in for an appointment is just too long for some. I mean, if they have to wait 2 weeks, 3 weeks, 4 weeks, or sometimes 5 weeks, it pushes them out of the gestational restrictions for abortion. And so we've been able to take care of them here in California. For me personally, that has been more than a call to action. I've been more intentional in trying to destigmatize abortion, talking about abortion, how normal it is within my community, particularly the Latinx and Catholic community. And I've just been very motivated to just continue talking about abortion and how it's a part of the full spectrum of sexual and reproductive health care.
Great. Thank you so much, Dr. Josie. Since we're on that topic, I wanted to ask both of you, over the past 30 years, more than 60 countries have liberalized their abortion laws. And at the same time, the US became one of the only 4 countries to go back in time by rolling back the legality of abortion alongside Nicaragua, El Salvador, and Poland. In your eyes and from your point of view, how, who and what is impacted by such restrictive policies, and how do you see the US exporting this anti-abortion sentiment throughout the country and globally? So I'm going to ask Dr. T to go first, please.
Yeah, absolutely. And I think it is important to reflect on the disproportionate impact on policies and practice and budgeting and resourcing, and often the lack of stewardship in the public sector. A lot of the people who are more disproportionately and negatively impacted by these restrictions are people who are already finding that they are marginalized in other areas or other aspects of their lives, that their other rights are already violated. Dr. Josephine spoke about the migrating populations. And if you understand the kinds of difficulties that it takes for people to make a decision to leave their home country, and how much trauma and violence they experience in transit, as well as when they have arrived at whatever destination they have, because they are migrants, because people understand that without the right documentation, with continuous threat of being deported or being found out, they are unable to actually seek help timelessly. The thing with abortion care is that we need our patients to present, to get information, to make the decision, and to get the procedure done timelessly. And the time factor is a big element here. And that's why a lot of the courts in the US are often fighting backwards and forwards about time. And so we know that a lot of the people who are opposed to abortion, often refer people or redirect them to these fake abortion clinics or these pregnancy crisis centers, and just to waste their time because they know time is of the essence. The other thing is that, of course, we know that people who are already living in poverty cannot often afford the multiple visits it takes to see a private gynecologist, to get information, to get care, and to get follow-up. The other element about abortion care that is also often not spoken about is the post-abortion care. A lot of our patients are lost to follow-up in that first 6 weeks after an abortion, simply because, again, they may not necessarily have transportation money to come back to the urban centers to seek the follow-up. They may not necessarily have leave from work to be able to take the time off to come back for care or for follow-up. A lot of people are in informal economy, in jobs that do not give them labor security. And so there's a lot of factors, and this is why this issue is a gender equality issue, because a lot of women, a lot of migrant women, a lot of Black women, Indigenous people are working in these jobs that are low paying, that don't offer them any protection and no leave. And it's definitely a racial justice issue as much as it is a gender justice issue as well.
Dr. Josie?
Yes, I completely agree with what Dr. T said. And going off of that, for such a long time, the rest of the world has looked to the US as an example of progressive policies, particularly like when it came to reproductive rights. And now, due to a series of unfortunate events that I should say we all saw coming, with the election of a not so great person in 2016, and then them appointing very conservative Supreme Court justices, we saw that this was going to happen. And so Americans have allowed the courts to dictate what a pregnant person can do with their body. And moreover, like almost half of the US states have allowed white male legislators who have no formal medical training whatsoever to dictate what a fellowship trained OBGYN in abortion care, what I can and can't do. And even if it's evidence-based medicine and part of the full spectrum of sexual and reproductive health care, it's so frustrating and so maddening. Particularly because as a Mexican American, we have Mexico to the south of us, where not only is abortion being decriminalized, but they are also on track to elect their first female president next year. It's absolutely embarrassing that Mexico is more progressive on these two issues than the US. And the US has a lot to learn from Mexico. And here we have so much work to do. And for countries that still see the US as a beacon of justice and an exemplary role model, they're going to take note and use the recent fall of Roe as an excuse to roll back progressive policies within their own countries. In other words, like these paternalistic countries will use any excuse to continue to control half their population, the population that happens to be able to birth, and deliver, to control them and take away their reproductive rights and their autonomy. And it's just so frustrating.
Yeah. Well, as an immigrant myself, this topic hits extra hard, doesn't it? So I'd like to give a trigger warning for the next question that I'm gonna ask. We keep climbing the ladder into this conversation, but I want to ask these two amazing doctors about the consequences of unsafe abortion, since we're talking about this already. This week we're talking about safe abortion worldwide because tomorrow is International Safe Abortion Day, but can you tell us a little bit about why it is so important to have legal access to safe abortion care within the context of a physician's office, from another trusted provider, or through self-managed abortion? We know that abortion is safe and effective healthcare, but there is so much misinformation about this, especially following the Dobbs decision. Can you elaborate a bit about that?
And maybe let me give you a more political, social advocacy answer, and let Dr. Josephine do the more clinical answer, because language is also something that's very important. And as someone who's been an activist and advocating for safe abortion access globally in many countries at many levels, we know that a lot of misinformation and disinformation and the pushback on abortion actually happens around language, right? And so I think maybe this answer is a good space to talk about that we absolutely are advocating for safe abortions and abortions in plurality, because you can have more than one safely and be okay. It's also important to talk about legality versus illegality. I'll give you an example of where I live in South Africa, where abortion has been legal since 1994, and that even now in 2023, unsafe abortions outnumber safe abortions 1-2 in a country that has legalized abortion since 1994. Now, that is a big problem. And so we have to not just only focus on whether something is legal, illegal, which of course has criminal consequences, but we also absolutely, to your question, have to talk about safe versus unsafe. And I can tell you as a provider, I've had patients who tell me in private, in confidence, that, look, doc, before I could get my second abortion with you, I had to go to some place where I wasn't certain, but I was just so desperate. And I think the desperation of women makes them, and anyone who's pregnant, makes them even more vulnerable to these people who are there to scam them, to redirect them to fake clinics, to be telling them things about adoption. And I think those things are also part of what we call dignified care. You know, safe abortion also has to be dignified. And some of the things that people go through in order to get that safe abortion eventually is also a problem. So I think I just wanted to maybe just say that prelude into safe abortion and why we are advocating so passionately but so correctly that this is a human rights issue, because we know that an unsafe abortion, often we talk about death, but there are comorbidities. And I will leave Dr. Josephine to talk about all of those comorbidities, and also to say that I know firsthand that one of the biggest things that my patients feel when they've had their abortion successfully is relief. So we also have to get rid of these other myths that abortions lead to some mental or emotional problems. There are reasons why people are asking for an abortion in the first place. And those things are already telling us that they are not in a space socially, psychologically, economically, politically, socially to have a child, right? And so we have to also be very careful and push back on this narrative that safe abortions or abortions somehow cause harm to women. But unsafe abortions done in unregistered providers, untrained providers with medicines that are not registered, that may be counterfeit, absolutely has particular problems. But safe abortions is what we are advocating for, absolutely. over to you, Dr. Josie.
Thank you, Dr. T. So I just want to say that when abortion is legal and accessible, it can be performed under medically supervised conditions, like under the care of myself or my colleagues or under the care of a clinician. This reduces risks associated with, unsafe or like unregulated abortions. By doing this, this protects the health and the safety of the individual seeking to end their pregnancy. However, when pregnant people don't have immediate access to abortion, they start to present later in pregnancy. I mean, it would be ideal that when a person decides to have an abortion, that they can either self-manage their abortion, they can obtain mifepristone and misoprostol to medically manage their abortion, or to undergo a procedural abortion. We all know that abortion is very safe. Very rarely are there complications involved. However, we have studies that have shown that there's an increase in complications the farther along that a pregnancy is when we do a procedure. So denying someone the human right of ending a pregnancy, you're putting them at risk of possible complications, or worse, if they're forced to carry their pregnancy to delivery, you're putting them at risk of an increased amount of maternal morbidity and mortality. Having access to legal abortion directly reduces the maternal mortality rates that we're seeing in this country, because we prevent deaths that could occur from unsafe abortion procedures that, somebody who isn't skilled in providing the procedure is doing under, the guise of anonymity. Because racism within our society and our healthcare, it exists, there's groups who are at higher risk that if they carry their pregnancy to delivery, they might die. This is something that we should leave up to the person to decide for themselves, for them to decide whether or not they want to continue their pregnancy and potentially risk death, because they are at much higher risk of maternal mortality, just, by the state that they happen to live in, the conditions that, that they've grown up with, and even the color of their skin. And this is all due to racism. And until we can improve maternal care for our marginalized communities, we shouldn't dictate when and what they do with their pregnancies.
Thank you. Thank you both. And to your point, Dr. Josie, we got a question in our Q&A box, and this is a reminder that all attendees can use this function to ask the panelists some questions. So this is actually a comment that we got from our partner, Dr. Paul Muliamboga in Uganda, which we work with a lot, and he says that he is also seeing a pushback on abortion rights due to the culture in Uganda and the religious beliefs of people in power at the moment. And however, he says we're doing what we can for these communities. So thank you, Dr. Paul, again, for your wonderful work down in Uganda. I wanted to say this, this is a Catholics for Choice webinar. So we are, of course, going to ask our panelists about the intersection of faith and reproductive rights. So Dr. T, Dr. Josie, how does your faith guide you in your work, and how can people of faith care for those seeking reproductive health care? How would you respond to someone who claims that you cannot be Catholic and pro-choice?
Well, obviously you can, because we are here, we exist, so you can absolutely be Catholic and be pro-choice and be pro-gender equality and all of the good things that are on justice. Funny enough, why I became a doctor was because I used to go to the monastery during my holidays and spend time with the nuns in the old age home there. And I think that's where my love for caring came out of. I never remember taking a conscious decision to be a doctor, but I do know that retracing my steps, it's all those years and years of spending time with the nuns in the old age home, taking care of the elderly, that perhaps, sparked that in me. And so for me, it's laughable that my entire existence and childhood would then not be seen as Catholic enough or anti-Catholic, just because I decide to respect pregnant people's choices, that I want dignity for them, and that I respect their choice and their decisions, whether or not they want to be pregnant or not. I am absolutely Catholic. I'm absolutely pro-choice. I'm absolutely an abortion provider. I may be a rebellious Catholic in the eyes of some people, but it's a badge that I wear with honor. And in fact, in my own family, we have Catholic priests. In my own family, my mother is the head of the liturgy at church. I don't get more Catholic than that. So absolutely, it's possible. And we are showing that indeed human rights are for all people, and that religion cannot be used to exclude or to discriminate. And in fact, I have support of my parish priests in the work that I do more broadly, but definitely in the work that I do around women's health as well. And it's no secret that I am an abortion provider. I will shout it out to anyone who wants to hear it, and that I am a Catholic, and I will do so in the UN as well, where, as you know, we face, and I personally face, a lot of pushback and harassment directed at me for being, I think also people get away with it more because I'm Black and I'm a woman and I'm a bit younger. Anyway, it happens a lot even within the UN itself, the harassment. And so it's something that we must take very, very seriously, and really support each other, and support, each other's work, and make sure that, we really do not tire of telling the truth and being honest, and also demanding that human rights be first and foremost, what we relate with each other as humans, and that everything else is secondary. But our human rights cannot be determined by our class or our religion or our sexual orientation or gender identity. You can imagine what trans people are going through in trying to access abortion in the name of religion, right? And so I absolutely am a Catholic, and I am pro-choice, and I'm an abortion provider, and I'm proud of that.
Thank you so much, Dr. Josie.
Thank you, Dr. T. That's so inspiring. I just like Dr. T, I'm a Catholic. I'm Chicana. I'm an OBGYN. I'm an abortion physician. I'm a wife, and I'm also a mom to 3 little muchachitas. So that being said, the intersectionality of being Catholic and being an abortion physician, they don't oppose each other. I feel more like they just, mesh well together because of all of my identities. It just makes sense. And to me, it's very logical that I, as a Catholic, am providing this type of care. My guide feeds me to meet patients where they are. Not only, when they determine for themselves that they can or can't handle pregnancy, but also like whatever, comes into their lives, and supporting them in that journey. And just like the clergy consultation service did before abortion was legal in the US, we should continue to provide compassionate, empathetic, and supportive care in their decision. According to Guttmacher, almost 1 in 4 patients who present for abortion here in the US, they identify themselves as Catholic, and that to me is not surprising. And this study was from 2014, and I'm positive that number has grown today. Abortion is a fundamental human right, and it transcends all religions. That innate right to be able to maintain one's own reproductive autonomy is something that we should all continue to strive for. And I will continue to, shout out that I am an abortion physician, that I support people in reproductive autonomy, and that this is something that's very normal, a part of sexual and reproductive health care.
Thank you so much for speaking about how your own faith guides your work. This is very important to us as activists and as people, and as people with uteruses as well. So before I fangirl over you two, I wanted to ask some questions from the attendees. Amanda asked, how can we support the mental health of patients who have to make these hard choices in an environment that does not value mental health? So any of you, if you want to tackle that question, that will be amazing.
That's an important one, and I think it speaks to resources in terms of how we think about women's health and women's clinics. For example, in our clinic in Johannesburg, we have a lay counselor, we have a nurse, we have myself as the general practitioner, and we have another professor who is also an abortion provider and a trained midwife. And so we have a lot of people in our small clinic to be able to do exactly that, and sometimes people don't know that they may be struggling with other aspects of their lives, and that, a whole lot of emotion, of course, happens at that time where they seek an abortion, and because the reality now sets in, right? Because they also have all of these other things, they now have to make this other hard choice. And so we are lucky in that we do have the staff complement for that. I know that in the public sector, it's very, very difficult to even find an abortion provider, to even find a midwife or a doctor who will even give the abortion in the first place. And so it is something to be said about the healthcare workers and how public health systems have to be better resourced in terms of, the ability for us to provide comprehensive care. At the moment, many people are not providing comprehensive care. We are providing the safe abortion, and that's the bare minimum that we can do. And I know that, in my next report, perhaps I can just share this with you, since I'm talking about healthcare workers, to the General Assembly next year, this time, I'm hoping to present a report on the healthcare workforce and all of the ways in which we need support in doing the work that we have taken an oath to do for the public, and the kinds of support and resources we require to be able to do that work ethically with longevity it requires. And one of them is that there are simply not enough of us. There are just simply not enough doctors and nurses where they are needed. And so it means that the quality of services given is not often guaranteed. The quality differs from one clinic, from one district to another. And patients sometimes are not, satisfied in terms of how they were treated overall. They may get the safe abortion, but they may have real feedback, to give us. But I do know in my context, in a low middle income country, that the amount of doctors and nurses available per patient, I was just reading this morning, we only have one doctor to 4,500 patients. So that tells you the limitations and the kind of strain that doctors and nurses are dealing with. And unfortunately, because patients and doctors are interacting with each other every single day, it seems that those failures are indication of personal or individual failures of doctors or nurses. And yet they themselves are struggling in their day-to-day work with mental health, with getting support from their superiors. I know as abortion providers, we often have to fight for clinic space, for the literal space where we have to work in the public health. And trigger warning, we've been placed in an old mortuary before as an abortion clinic in a public health hospital. And so as much as we know what we need to be doing for our patients, we also do this with a lot of guilt, knowing how much we can't do for our patients. And I think we do have to advocate for better working conditions of healthcare workers, particularly abortion providers. And therefore, by doing that, we are also advocating for patients' healthy healing environments as well. Thank you.
Thank you, Dr. Josie.
Yes, we know that in the medical field that restricting access to abortion can have adverse effects on mental health. This leads to people having more stress, more anxiety, and just more overall trauma than they need to be subjected to. We've seen this with the Turnaway study, which was done by my colleague, Diana Green Foster here at Answer. And in fact, we've taken care of patients who have attempted suicide because they didn't want to be pregnant anymore and were being denied the right to end their pregnancy. Forcing someone to birth puts them under undue stress, and having legal access to abortion supports the overall well-being of those seeking abortion care. And I also just wanted to mention that patients having or attempting suicide because they don't want to be pregnant is another aspect of, the topic of restricting access to abortion that the media doesn't know about because they don't see it. But we've seen increasing cases, a number of cases of patients attempting suicide because they no longer want to be pregnant. It's something that we don't really talk about because it's not, it's not for me to tell their story, except to say that it's happening. I can't give details. I can't say how often it's happening, and I can't say, the demographics of the patient, but it's things that people don't fathom can occur. And if the public only knew what people encounter and what they go through in order to access abortion, this wouldn't be an issue for people to be arguing over. It'd be, a very cut and dry issue that people need to have access to abortion in the US. No questions asked.
Mm-hmm. Another question that someone in the chat asks is, it's very interesting. It's about if you could speak more about the ways that you see your patients bringing their faith into their decisions.
That's an interesting one because I've experienced both sides. So when my own belief is being questioned by a patient who is seeking an abortion, who is going to get the abortion, but they, I think, sometimes project their own fears onto me. And so I always take it as a moment to be even more empathetic and also explain, the fact that I do this work because of my faith and my religion, and not in spite of it. There is no internal battle going on. And that kind of seems to ease them a little bit more. But I do know that a lot of us face a lot of inner turmoil because of religious text or religious rhetoric on even things like contraception, on being a woman who wants to go in the workplace, on being a woman who's earning more than their husband. So I always show my patients that the issue of religion and judgment is everywhere in our lives, and that I'm grateful that they found us and they are going to get safe, dignified, supportive care. And that's what I'm concerned about. I know that some people have a much deeper bond, I suppose, with religion. And I have referred people to a religious person before who I know is pro-choice and who's an advocate and activist in the movement as well. And so a lot of the people that I'm a movement builder with around the HIV movement are actually indeed pastors and clergymen and women, by the way. And so we help each other in that way. And that's why the global gag and those restrictions do affect our ability to not be isolated as abortion providers, because I can't lean on my colleagues in the HIV sector who are much more resourced and funded than an abortion provider will ever be in their whole lifetime. I can't tap into those resources, because if they work with me, they risk their funding being withdrawn, right? And so this is another example of collaboration in a way that we don't often think about, but it does happen. I have sought services and advice of a spiritual leader before, who is pro-choice, but who's also an activist for women's gender equality and LGBTQ plus rights as well. And so for me, and I call myself a movement builder because that's really important, and I've seen firsthand how that's really valuable for clinical care. And that's what comprehensive care is about. It's not just doing your little bit and leaving. It's ensuring that your patient is connected, even though I may not give them the necessary support, but I connect them to people who can do that. Thank you.
For what I've experienced for patients that tend to have, or either question my faith or are questioning, having an abortion, and if that is in line with their faith, I find that happens with all religions, not necessarily Catholics in particular. And when it does, we support patients however we can in answering the question as to what's causing distress or confusion or doubt. For people that identify as Catholic or, mention that they have like a Christian faith, we've seen a wide range of emotions, feelings and perspectives as to like why they feel that way. We support them. Our patients happen to undergo a very long session, like counseling session, just making sure and affirming that this is the decision that they want to make. And so we explore not only like their faith and what affiliation they have, but also how their decision is in line with that faith. And most of them are it's very congruent most of the time. And it's a journey that we find that only the patient can make for themselves. We are just there to support, we listen, we ask open-ended questions. And most of the time they already know what they can take on for themselves in their lives. And we just support them in helping, come to terms or like to air out their emotions. And for patients that, that decide that, terminating pregnancy isn't for them, we completely 100% support them in that decision. No doubt, no questions asked. And so most people, I want to say 99.9% of people know what they want when they come to care with us. And so I, for the most part, find that it's hand in hand. The compassion that they're seeking, the empathy that they're seeking, and the religious faith, it guides them all in the same direction to be able to be the best person that they can for their families. A lot of them are already parents, and in deciding to terminate a pregnancy, it's a decision that every person's different on how they react to that decision. Some people it's easy, some people it's difficult, some people are in the middle, some people are ambivalent, but for everybody it's different. So I can't say across the board that for Catholics it's much more difficult, because that's not the case at all. And so me as a Catholic identifying abortion physician, I'm just here to support them. I'm here to support people in all of their religious affiliations in deciding to maintain their reproductive autonomy.
Thank you both. I see that Dr. T is addressing another of our questions in our box. So I'm gonna go ahead and read the last one that we have, since we're doing great with time today. So Collins in the Q&A box raised a very important question, or raised a very important point about this space right now being a very elitist space to talk about all of this, and how do we actually reach and what we will call an ordinary woman in a very remote country, in a very patriarchal society, who is not even aware that abortion is a right. So what mindsets, mechanisms are available to reach her and such societies as a whole? So before I pivot to the both of you for the last time, I can say that from USCFC, we are a nonprofit working globally to advocate for abortion care and abortion access. I think it's very important to recognize that when we talk about reproductive health and reproductive justice, we recognize that a threat to it anywhere in the world is a threat to it everywhere in the world. And we can't just focus in some regions of the world, like picking a region. And we really do try to recognize and voice out the fact that we need to be aware of this at all times, everywhere. And this is a global issue. It is. So yeah, that's, I wanted to say that we as an organization are working hard towards that. So thank you for raising that point. We do have about 8 more minutes if you all want to say something else, Dr. T, Dr. Josie.
I think it's important to talk about abortion and human rights and issues around access everywhere that we possibly can. It's a duty that I carry. And I am an ordinary woman, and I see ordinary women every day in my practice. And their stories and their lived experiences is what keeps making me be so defiant and keep doing this work. It is because of that knowledge of how difficult patriarchal control is over women. And in one of my reports to the UN, I called it patriarchal violence. And we need to understand that the kinds of restrictions and the kinds of harassment and the threats, both by family members, by society, communities, but also the law itself, the law, that a lot of what that is, it is patriarchal violence. A threat to your humanity, a threat to your dignity, in often times leads to literal physical bodily loss of integrity and harm. And those are patriarchal violence moments. And so I frame it that way to also try to bring and to show to people that these are not just a group of women just talking about their bodies. These are real issues with consequence. And those women in far-to-reach societies know exactly what they want. They already have their vision for the future. They are already raising their children with less than $1 a day. They are already living through intimate partner violence, community-based violence, gender-based violence. What those women need is to be heard, and the threat of them speaking up to be taken away. Inherently, all of us want what's better, what is good for ourselves. We don't need to go tell it to women in far spaces or in rural spaces or in patriarchal societies. What we need to do is end patriarchy and allow women everywhere to live freely without patriarchy. The problem here is patriarchy. The problem is not any space anywhere that other women are creating for themselves. The problem is patriarchy, where other women are unable to be free of that patriarchal shackle and that patriarchal violence. And so we really have to do the work of reaching women in the languages as well. For me, language is a big barrier. And that's why, you know, I go to as many places I can in the world. I make sure that I write in ways and I speak in ways that is easily understandable, because it is true, you can't fight for rights you don't know you have. But there's consequence and there's a real cost to fighting for those rights in many communities. And so I think it's for all of us where we are to be able to not just fight for the causes or the issues that affect us where we at, is to be conscious of how we are intersectional and we're inclusive of everyone everywhere, including women with disabilities who require abortion for a variety of reasons. I don't need to be in every space, in every table, in every conversation to know that the issue of safe abortion and gender equality is being taken seriously. We need to build movements that I know that my colleagues in climate change discussions are putting the issues of sexual and reproductive health and abortion and migrant women and refugees and women with disabilities on the agenda, because it's impossible for us to be everywhere we are needed, right? We are the least funded of any movement in global health. So we need allies and we need people to be co-conspirators with us to send the message where it needs to get to. Thank you.
Thank you. And Dr. Josie, you want to close us off?
Yeah, I just wanted to say that was such a good question for the audience member to ask, and I appreciate them asking the question of us. I do agree. Sometimes it seems that, you know, this movement can sometimes have elitist connotations. However, I think it doesn't mean that those that are not in or don't have a platform don't deserve to have access or don't deserve to have evidence-based medicine be accessible to them in their part of the country or their part of the world that they may be in. A person in a third world country who doesn't have access to healthcare may not know that abortion is very much a part of that. They may not know that they're being oppressed of their rights by their government. They may not know that their government is restricting, you know, what media they're exposed to or what news that they get to watch Most of the time it's, patriarchal countries that restrict access to social media and restrict what news their population listens to, what type of healthcare their communities can access. Abortion is a human right, and just like being free from violence is a human right, just like having access to education is a human right. We have to do the work to normalize abortion and continue to speak out against oppressive governments. I think this goes hand in hand. I think we will eventually reach parts of countries and of the world that, what the audience member asked about. We just have to continue to advocate for basic human right of abortion care to every citizen of the world.
Thank you, Dr. Josie. Thank you, Dr. T. We're running out of time. Unfortunately, we're in our own internal chat being like, no, we're running out of time. But this conversation has been so powerful and so important, not just for us at Catholic for Choice. I'm sure the attendees as well are hanging on to every word. Well, this isn't the end. We will be following up via email, so we can keep this conversation going. But again, I wanted to thank you for joining us today. This has been truly amazing, and you are both in very remote parts of the world. We're all separated, but we're all here anyway. So again, I'm really grateful. I'm sure everyone here is as well. So thank you again for joining us, and thank you to Jose Luis that's been translating the entire time to Spanish. So big applause for all of you today. And again, thank you. We have made it on time. I'm very impressed. And again, we will be following up with all attendees. And I just wanted, before we close, to highlight that Catholics for Choice will be hosting a Green Mass in Washington, D.C. this Sunday. If you are not aware, there is a Red Mass happening this Sunday. It's a ritual that claims to be nonpartisan, and it happens on the Sunday before the Supreme Court begins its new session. So Catholic for Choice will celebrate a special liturgy led by a Catholic Roman priest. So you're all cordially invited to attend. So again, thank you all so much for being here. Thank you, everyone. And this conversation was truly, truly inspiring. So I'll see you all soon.